Hi, so welcome back to the second episode of my pregnancy journey with fibroid. So one thing I noticed throughout this journey was people tell you, be okay, don't worry, everything will be fine, just be strong. But they do not understand the pain. I don't know how to explain it, but that pain, I don't pray for my enemy, like my worst enemy. I can't, that pain was crazy. The pain was driving me nuts. It's not just a physical pain, it's a mental something. It was bad. Bad. Like, I'll try to put a picture of me or video like somewhere here or here for you to see. And then one thing my gynae said was, anytime the pain comes and you can't walk, come to the hospital straight. It means it's bad. The first time the pain came and I couldn't walk was first trimester just finished. So I entered the second one. It became so bad, and the gynae that discharged me the following day when the pain subsided said, I'm sorry to tell you this, but there's more to come. And there's nothing we can do about it. We can't help you. We can only help you manage it, but we cannot really do anything to prevent the pain from happening. It got to a point that the moment I get to the hospital, they already know I'm there. I didn't need to say anything. They just start picking everything that we need, and then they will take care of the pain and everything. So the second time I had this pain, they gave me the first dose of morphine. 1 hour later, nothing has happened. I was still in severe, terrible pain. The gynae came back and was like, by now this thing this is supposed to have subsided small. No, this thing no gree subside. They had to give me another dose. They gave me another dose. As they gave me the second dose, I was still taking the regular painkiller, not your regular Tylenol, or I don't want to mention the name. I was still they gave me that one while they also gave me the injection. I don't know. The whole thing was not just it was not just subsiding. This pain lasted for 4 hours, 4 freaking hours. I was in pain, the pain that you cannot explain. So this is how it usually happens. When the fibroid it was on my left side. So the baby was on my right side. So the fibroid took the whole left side, and the baby only had the right side. So the baby couldn't swim around, couldn't move as much the way baby kicks and stuff like that. So it's on the left. When it comes to the middle, it will come to my navel area, that's when the pain comes. And that thing does not give notice. It's not pain that will start small and then increase. No, it just starts, and that is it. It just starts bad like that. So after the second admission, the doctor now said, okay, at this point we have to prescribe you a painkiller that you are going to be using at home. So they prescribed me hydromorphone. When I went to the pharmacist to get it, the pharmacy asked me, does your doctor know you are pregnant? Because this medication is not for a pregnant person. I'm like, yeah, my doctor knows. He was just telling me, don't abuse it, don't use it anyhow, only use it when it's necessary. I was like, my doctor has already told me all the implications of this drug. I already know what is meant for. So, yeah. So I just need to let you know that this pain was not pain that is number one complication I had was my iron level. My iron level went down so bad, I became severely anemic. So I had to do iron transfusion. I'll put the video here. I did iron transfusion. I did the first one. Like they had to do it back to back within 2 weeks. Then they waited another week, check it again. Where it was when I started, it was still, my iron level was still there when I finished the transfusion by the 3rd week. My gynae said, okay, at this point, maybe I will have to do blood transfusion. I'm like, see, anything I have to do right now, my hands are up. I'm ready to do anything and everything that you want me to do. We will need, and this whole journey, I couldn't eat. So that one on its own was already bad. I couldn't eat. I couldn't drink water. They had to say, okay, maybe I should be taking puree or those things, but I couldn't. Any food that has pepper, tomato, shepherd pepper, any type of pepper, I can't eat it. And I wasn't throwing up. That was the good part of it. That was the first complication that we had to manage. The second one, because of the pain, my blood pressure went up. So anytime I'm in pain, my blood pressure goes to as high as 190, 130. That is already like a bad signal. Like even for a normal person, not to talk of somebody that is pregnant, having that kind of blood pressure is bad. And the truth is, I'm still dealing with that thing. That thing has refused to go away, but not as high as the way it was. So anytime the pain comes, my blood pressure goes up, then it goes down. But there was one particular pain episode I had that lasted 7 hours. 7 hours I was in pain. I'm not in labor, but I was in severe pain. The blood pressure went up and didn't come down. It didn't come down, and I now had to be on blood pressure medication. The bad part was the fact that I was on blood pressure medication still. My blood pressure was not responding because I was like by the time I got to the middle of 2nd trimester, the pain has increased so bad that I was continually in pain. Like the pain now is like almost every day, like every other day. So even though I'm taking the blood pressure medication, the blood pressure, it will go then up, down a bit, then the pain will come, then it will go up again. Then I had hypothyroidism. I don't know where that came from. I was just on my own and I got a call from a specialist and they said, you have an appointment. I'm like, appointment? I didn't book any appointment. Then I spoke to my gynae and she was like, oh, don't worry about it, just go. I went and did the test again. I did not know the test they do, but I knew that they were doing blood work like almost every time. I don't know why. And she was like, it's not so bad, but you have hypothyroidism, and if you don't treat this thing, it can lead to eclampsia. Oh my God. That was so scary. So I started reading about hypothyroidism in pregnancy. They say it was pregnancy induced. My first pregnancy, I didn't have any of these things. So pregnancy induced hypothyroidism, they had to manage it. And the medication for that thing, I had to take it early in the morning. Anytime I take that medication, I feel faint. Like it feels like I want to faint. And when I take it, I have to wait 2 hours before I take other medications. I have loads of medications that I was taking. That was the second complication. Like that's like the third complication. So the high blood pressure, anemic, then hypothyroidism. I don't know the test they did again, and they said they had to do liver functioning tests. So at this point, I said, God, just take control because I don't know again. This is becoming too much, and now The baby was growing, but was not growing at the rate it's supposed to grow, because the fibroid is not giving it room to really grow the way it was supposed to grow. I was becoming so scared, like, I hope I can still have this baby, I can carry this baby. But my gynae was super amazing. She kept encouraging me, don't worry, we're going to do our best, this one, that one. So 4 complications. Then I started having at one. That one was bad. I had to be on another medication for that. So now I'm on medication for 5 things, apart from the pain. The pain medication, I had 3 different type of pain. So pain medication. So I had to start little by little. So I'll start, if the pain come, I use this one, it doesn't work, then I jump to the next one, it doesn't work, then I jump to the next one. If it doesn't work, then hospital, then they take it over from there. If you are in this position right now, when I was going through this journey, I went on YouTube to search if there's anybody that went through pregnancy with fibroid, multiple fibroid, or even one fibroid. I didn't see video. People just talk about they took it out and how they got they took in when they took it out and stuff like that. I didn't see someone that have gone through the pain, that have gone through the pregnancy, and the fibroid is there. Like, I couldn't see any video like that, and that is why I'm making this video. Let me tell you something. Doctors can feel like they know what you are going through, they know what you are going through, but you feel it more. It's you that have gone through that pain that can really explain what you have been through. When I was 35 weeks, the baby was not even up to 2 kg. So I had one terrible pain episode that day. That single day, I saw 3 gynae, and they've given me the first dose of morphine. As they were giving me the injection, I was taking the tablet. First, second, third, this pain was not going. So one of the gynae, the second gynae that came, said, you have to try, because we have to get this baby to 2 kg. If not, when you give birth, we have to put the baby in ICU. The good part, the baby was breathing well, and at that point, everything was looking okay. Then I had bleeding nose. I had bleeding nose all through. I don't know what was happening, but my nose kept bleeding. I don't have, like, those things are not things that I had before or I have experienced before. So I had bleeding nose all through the journey, like all through. My doctor was like, see, that one is not even an issue. Let's even leave that one aside. Then as the journey continued, at some point, I started having chest pain. I don't know what was causing it, and the whole thing was becoming scary. My gynae, we picked date, so the delivery was supposed to be like in June. Then we picked the date, then we shifted it to May 28, then we shifted it to May 21, then we shifted it to the May 17. Like, we kept moving it forward, like, because she realized that, okay, if we do longer, this whole thing might not be successful the way we want it, but we want it to be successful. So if you are pregnant right now and you have fibroid and you are dealing with it, you're not alone. I've been through it. I came out successful. It was not an easy journey, but trust me, you'll be fine. You'll be fine. So I think I'll stop this episode right here, and the next one, I'll talk to you about your birth option when you have fibroid, because your birth option will determine the outcome. If you're going to make it, or is the baby that will make it, or one of you will make it. If you choose the wrong birth method, it can be bad. So thank you for watching. I hope I'm not boring you with these messages. I hope that you're enjoying this episode as it's going, and I hope you're learning something from it. I'll see you in my next episode. Peace out.